नमस्ते बिटिया हमेशा खुश रहो बिटिया In this series of lecture, our today's topic is disorder and tumors of vulva. Myself, Dr. Arti, Associate Professor, Pathology Department. Today we are going to discuss with the tumors of vulva. The normal structure vulva, we already talked about that it consists of the labia minora, majora, mons pubis, clitorius, vestibule, hymen, Bartholin gland, and minor vestibular glands. The inner surface of the minora and majora and vestibule are covered by stratified squamous epithelium, and clitoris is a vascular erectile tissue, and Bartholin and vulvovaginal glands are located one on each side of the mass of tissue, forming the labia minora. Now we will talk about the conditions of the vulva that are very rare, but it is important for you. One is a Bartholin cyst and abscess. The inflammation of Bartholin vulvovaginal gland, Bartholin adenitis, may occur due to the bacterial infection, notably gonorrheal infection. The infection may be acute or chronic. Acute Bartholin adenitis occur from obstruction and dilatation of the duct by infection, resulting in formation of the Bartholin abscess. The microscopic examination shows the usual appearance of acute suppurative inflammation with neutrophilic infiltration, hyperemia, edema, and epithelial degeneration. Chronic Bartholin adenitis results from a less virulent infection so that the process is slow and prolonged. Alternatively, the chronic process evolves from repeated attacks of less severe acute inflammation, which may be short of abscess formation resolved incompletely. In either case, the chronic inflammatory process terminates into fluid-filled Bartholin cyst. Microscopic examination show variable lining of the cyst varying from the transitional epithelium of the normal duct to a flattened lining because of increased cystic pressure. The cyst wall may show chronic inflammatory infiltrate and a few mucus secreting acini. Non-neoplastic epithelial disorders, the older nomenclature vulval dystrophy has been replaced by more descriptive and clinical relative term, the non-neoplastic epithelial disorders of vulval skin and mucosa of the vulva. The term is applied to the chronic lesions of the vulva, characterized clinically by white, plaque-like pleuritic mucosal thickening and pathologically by disorders of epithelial growth. The clinician often uses the term leukoplakia for such white lesions. Currently, the non-neoplastic epithelial disorders of the skin of the vulva include two lesions. One is the lichen sclerosis. The lichen sclerosis may occur anywhere in the skin but is more common and more extensive in the vulva in postmenopausal women. The lesion may extend from the vulva onto the perianal and perineal area. Clinically, the patient, usually a postmenopausal woman, complain of intense pruritus which may produce excoriation of the affected skin. Eventually, there is a progressive shrinkage and atrophy resulting in narrowing of the introitus, clinically referred to a keratosis vulva. Microscopic examination show hyperkeratosis of the surface layer, thinning of the epidermis and disappearance of the retiridges, amorphous homogeneous degenerative changes in the dermal collagen, chronic inflammatory infiltrate in the mid-dermis, and the lichen sclerosis is not a pre-malignant lesion and respond favorably to topical treatment with androgens. Squamous hyperplasia or second condition is a squamous hyperplasia. This is simply called keratosis. It's characterized by white thickened vulval lesions which are usually itching. Microscopic examination show hyperkeratosis, hyperplasia of squamous epithelium with elongation of the retiridges. Increased mitotic activity of the squamous layer but cytologically no atypia. Chronic inflammatory infiltrate in the underlying dermis. Squamous hyperplasia is not a precancerous condition. However, a variant having marked acanthosis, parakeratosis, and viruciform architecture is called the vulval acanthosis with altered differentiation. Does not have HPV associated human papilloma virus, but may be forerunner of HPV negative vulval cancer. Now there is a vulval tumors like the stromal polyp, stromal fibroepithelial polyp or accordons may form in the vulva and vagina. There may be a single and multiple polypoid masses. Microscopic examination show they are covered by an orderly stratified squamous epithelium. The stoma consists of loose, fibrous, and myxomatous connective tissue with some adipose tissue and blood vessels. Papillary hydradenoma and papilliferum. This is a benign tumor arising from apocrine sweat gland of the vulva. Most commonly, it is located in the labia or in the perianal region as a small sharply circumscribed nodule. The microscopic examination show the tumor lies in the dermis under a normal epidermis. The tumor consists of papillary structures composed of fibrovascular stalk and is covered by the double layer of epithelial cell, a layer of flattened myoepithelial cell, and an overlying layer of the columnar cell. Now, condylometal acuminatum is also another condition. This is an anogenital wart. These are benign papillary lesions of squamous epithelium, which can be transmitted venerally to male sex partner. They may be solitary and more frequently are multiple, forming soft warty masses. The common location are the anus, perineum, vaginal wall, vulva, vagina. They are induced by human papilloma virus, particularly type 6 and 11. Microscopic examination, they are identical to their counterpart on male external genitalia. The features consist of tree-like proliferations of stratified squamous epithelium showing marked acanthosis, hyperkeratosis, parakeratosis, papillomatosis, perinuclear, vacuolization of the epithelial called the Chyliocytosis indicative of HPV infection. The capillary projection consists of the fibrovascular stoma. Extramammary Paget's disease, these are the disease of vulva, is a rare condition which has a skin manifestation like those of Paget disease of the nipple. Affected skin, most often on the labia majora, appears as map-like, red, scaly, elevated, and indurated area. Microscopic examination shows the extramammary Paget's disease is identified by the presence of large pale carcinoma cell laying singly or in small cluster within the epidermis and adnexal structures. Unlike Paget's disease of the breast, in which cases there is always an underlying ductal carcinoma, extramammary Paget's disease is confined to the epidermis in most cases. Now, the vulval intraepithelial neoplasm and invasive carcinoma. Vulval intraepithelial neoplasia and invasive squamous cell carcinoma are morphologically similar to those in the cervix and vagina. The etiological role of the certain viruses in carcinogenesis, particularly high-risk HPV type 16 and 18, in these sites is well documented. VIN is often multifocal within vulva and may be multicentric. General examination show white lesions. This is called the leukoplakia, white layer. The area develop an exophytic and endophytic and growth pattern. The traditional VIN lesion described as Bowman's disease of the vulva and is generally slightly elevated and velvety plaque lesions. The microscopic examination show just as in cervix, VIN may also range from 1 and 3, higher grade being also called Bowman's disease. Vulval cancer is a squamous cell type with varying degree of anaplasia and depth of invasion depending upon the stage. HPV position tumors are more often poorly differentiated squamous cell carcinoma, while HPV negative are well differentiated keratinized type verrucous carcinoma is a rare variant which is a fungating tumor but is locally malignant. Now this is the reference I created. I hope you enjoyed this session. If any query, mention it in comment box. Thank you so much. Bye bye. Take care.